You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
Hi, I'm Dr. Lori Marzell, and I'd like to talk to you about some more tidbits about hormone management for women. For most women, hormone therapy is reserved for a time when the ovaries are not functioning or are decreasing production of estrogen and other hormones. In other words, there is a definition for menopause, which is when we think that women should need hormone replacement. Menopause is, quote, the textbook definition, when women have not had a period for 1 year. Now, does that make sense? So, women have a decreased production of estrogen possibly years before they stop having periods. And so you have a lot of time that you're going to have a variance of things in tissues, symptoms, problems occur. Things in nature don't usually just turn on and off. They don't wait for a year and suddenly, oh, well, let's turn off the ovaries. And there is no reason to wait a year or 6 months. And there's a lot of reasons to consider carefully adding hormone support before women reach the textbook definition of menopause. Why are we letting women suffer? Okay, let me talk a little bit more about this and you'll understand what I'm saying. Hormone production, if it starts varying in perimenopause, what it does is it goes in an up and down kind of phase. It's kind of like a car that's running out of gas. It lurches up, so it produces maybe a little too much estrogen, then it drops, then it lurches up again, and then so you have this up and down production of estrogen. Now, the reason it's not a good idea to test for how much estrogen do I have, is it enough, is that if you are perimenopausal, you may catch it at a peak. It may look just fine and dandy. But the next day, it may be at a trough. And it may look, oh my goodness, hey, we're not producing enough. It's usually not a really smooth sailing deal. So the problem is, though, it's not the lurching up that is the problem with women. The problem is the drop. If women are dropping hormones, the deal is that this is not just a reproductive hormone. This is a hormone that's present in your brain, it's present in your bones, it's present in your, and I don't mean the hormone itself, but let's say the hormone receptors that need that hormone for healthy function is in your brain, your bones, your heart, your arteries, of course, your genital tissue, urinary tissue. It stimulates parts of your gut so that your gut will produce more serotonin and you'll be not anxious. It can disrupt the normal rhythm of heart. It can cause plaque if you don't have enough estrogen. So it's all over the body. When it starts not functioning, women are going to have problems. And so let me talk about that a little bit, because we have a lot of doctors who are really not comfortable with giving women hormone support. Let's talk about women who have migraine headaches, particularly women who have premenstrual migraine headaches. This is a very, very common occurrence. This means that in the week prior to menses, this is usually when it occurs, women develop a migraine. It's not in the rest of the cycle, and it can occur cycle after cycle after cycle. Well, what's going on is that estrogen is a really super potent vasodilating hormone. So if it will be produced in an upward trend until ovulation occurs, which is mid-cycle. After ovulation, it starts going down. So if you have something that is vasodilating, it's opening up all those blood vessels, and then it starts going down, you're losing the vasodilation action, and vessels will start to close. With some women, that starting to decrease the size of the blood vessel will go into a spasm, and that's when migraine headaches occur. Well, you can pretty much resolve all these with women. They don't need estrogen through their whole cycle. They're doing fine until they get to the week before their period occurs. And this is the time when estrogen is the lowest. If you provide something like a patch during this time, it will keep the arteries open, and a lot of times it will resolve premenstrual migraines. Now, it will do this in a very safe manner by just buffering the effect of the drop in estrogen. It's not a drug that has all kinds of weird side effects. It's a natural substance, and you're just helping make things a little easier for women. Doesn't that sound reasonable? You're looking at the way the body functions, and you're working with it. Well, I think it makes a heck of a lot of sense. I would like to talk to about some other patients. I had one that in that week before her period, she suddenly became extremely fatigued. So much so that she had to submit to bed rest at this time of her cycle every month. She advised me that she was so fatigued and depressed that she sometimes had to be assisted by her husband to use the bathroom. I have had many others who experience such strong changes during this time. They may have uncontrollable anger, rage, or severe depression. All of the cases I have treated by using a supportive dose of estrogen during this week. These are symptoms that only occur during this week. But if you use a little tiny support of estrogen, a lot of times the energy is good, they feel better, they function better, and they have more. The mood is better, the rage, the anger modulates, the depression goes away, and life is better. So if you are essentially losing a week of your life to this severe reaction that some women have, not all, but some women do, every month, this is getting to a point of ridiculousness. We have tools to fix things. I want to talk to you about another one. One of my first cases in treating women who were not in menopause with hormones was a woman who suffered from episodes of atrial fibrillation. This is a strange rhythm where the heart goes out of its normal rhythm into a kind of a confused type of rhythm where it's all over the place. There's no regularness to this rhythm. It's just kind of all over. It's not good for your heart, and it can incite a response that's too fast or too slow. Anyways, it needs to be corrected most of the time. So this woman came into my clinic complaining of episodes of atrial fibrillation. She states the episodes caused her to have to go to the emergency room. And when she started talking to me about this, I said, excuse me, but I think you're in the wrong place. You need to talk to a cardiologist. And she said, no, she thinks that talking to me was the right one. She said she's been tracking her episodes, and she noticed that it occurs monthly. She also noticed that guess when it occurred? During the week before her period. So every month in this week, she had a little trip to the emergency room trying to get her heart under control. It's not commonly known that there are estrogen receptors on the heart itself. Drops in estrogen can increase anxiety through two mechanisms. One is a direct increase in epinephrine, and the other is that estrogen stimulates serotonin in the gut, and so if you decrease your estrogen, you will decrease serotonin. So there's two mechanisms for you to have more anxiety, which can increase the signals to the heart to beat, so you can get excessive stimulation there. But the third mechanism is there's direct receptors on the heart tissue itself. And so if you have a decrease in your estrogen, you can have heart rate variability, premature beats, or other arrhythmias, such as, in this case, atrial fibrillation. I treated this woman, and guess what? Her trips to the hospital stopped. She felt better, and the atrial fibrillation resolved. What do you know? We look at how a body is functioning, and we respond to what it needs to function appropriately. I'm happy to share these little tidbits of information with you because hormone replacement therapy is a tool that we should not be afraid to use. It's part of our natural orientation, something that we need, particularly estrogen. It's all over the body, and it can cause all kinds of problems if we don't have enough of it. Stay tuned, and I will be speaking more about some exciting cases and other tidbits of information. Thanks for listening.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.